Welcome to the WMed Specialty Spotlight Podcast, your virtual mentor for choosing a medical specialty and planning a career in medicine. On this podcast, we probe practicing physicians with questions about their specialty, the decision algorithm that helped them determine that the specialty was right for them, and then for advice about long-term career planning, irrespective of the field they went into. I'm your host, Dr. Biren Shah, WMed Assistant Dean for Career Development. Before introducing today's guest, I just want to remind you that selected show notes for this episode and all episodes can be found on our website, wmed.edu/specialty spotlight. The specialty of today's show is general surgery, and the physician here to tell us about it is Dr. Saad Shebrain. Dr. Saad Shebrain is the Residency Program Director of the General Surgery Residency Program and Professor in the Department of Surgery at Western Michigan University Homer Stryker MD School of Medicine. After completing his medical degree from the University of Cairo, Dr. Shebrain did a general surgery internship at the University of Cairo. He then went on to do a general surgery residency at the UCLA Medical Center, followed by a fellowship in minimally invasive and foregut surgery at the University of Washington in Seattle. Dr. Shebrain also did a master's degree in medical management from Carnegie Mellon University and did a mini fellowship in laparoscopic bariatric surgery at the Cleveland Clinic in Cleveland, Ohio. So without further ado, Dr. Saad Shebrain. Dr. Shebrain, welcome to the show.
Thank you, Dr. Shah, for the opportunity to be with you today in this podcast.
So you heard me read your bio. Is there anything that you'd like to add, or maybe you'll share a little bit about yourself and your decision to go to medical school?
As a foreign grads, when we came to United States, we faced a lot of challenges. And when we applied to surgical residency, there is a high likely that you will get into a prelim. So I spent 1 year as a PGY1 prelim in the University of Illinois before I moved to Harbor, UCLA in California.
And the way I like to start off is by reading you a description of the specialty from the Careers in Medicine website, which is hosted by the Association of American Medical Colleges. A general surgeon has principal expertise in the diagnosis and care of patients with diseases and disorders affecting the abdomen, digestive tract, endocrine system, breast, skin, and blood vessels. A general surgeon is also trained in the treatment of patients who are injured or critically ill, and in the care of pediatric and cancer patients. General surgeons are skilled in the use of minimally invasive techniques and endoscopies. Common conditions treated by general surgeons include hernias, gallstones, appendicitis, breast tumors, thyroid disorders, pancreatitis, bowel obstructions, colon inflammation, and colon cancer. How much of that do you agree with? What would you add or subtract to ensure that anyone listening was well informed of the practice of general surgery?
I think what you just described is the outline for what general surgery and general surgeons do. I would like to point out to 3 issues that I think medical students should know. First, the term general surgery implies the field of surgery that has a central core of knowledge not only in basic science, but also in clinical aspects of diseases which are common to all surgical specialties. This knowledge includes anatomy, physiology, pathology, trauma, shock and resuscitation, critical care, and neoplasms, just to mention a few. Second, the term general surgeon implies to the surgeon who has specialized knowledge and experience related to the diagnosis, perioperative care, operative interventions, and postoperative care and management of patients' condition included in the essential components of surgery. You have mentioned most of them, and I would like to reiterate. The essential components of surgery, as defined by the American Board of Surgery, includes 9 categories. Alimentary tract, including, for example, stomach, colon, small intestine, abdomen and its contents, for example, gallbladder, liver, spleen, hernias. The third component is breast, skin, soft tissue. Fourth component, head and neck, especially thyroid and parathyroid. The fifth component is vascular system, excluding the intracranial and the heart. The sixth component you already mentioned, that include endocrine system, that include also thyroid, parathyroid, adrenals, and even endocrine pancreas. One also important component of general surgeon practice is surgical oncology. In addition, comprehensive management of trauma patient, it is an essential component of general surgery. And the last component is complete care of critically ill patient with underlying surgical conditions, whether in emergency room or intensive care unit and trauma and burn units. And as you can see, this is really a wide spectrum of skills and practice that surgeons will be able to do. And the third thing that I would like students to know is residency in general surgery includes training for at least 5 years. Some programs may require a mandatory, or they may offer 1 or 2 years of research, totaling training in general surgery into 7 years in some cases. General surgeons are certified by the American Board of Surgery, a recognized surgical specialty by the American Board of Medical Specialties.
Can you tell me or take us through what a typical daily or maybe weekly routine looks like for you, followed by the typical series of patients that you would see, and what are the typical outcomes for these patients? And probably that question may vary in terms of outcomes, but
yeah, I think this is really a very important question, and I think students should know about general surgery practice as they plan it as a career. You know, in medical school, people, they talk about lifestyle, about career, what do you want to do? And I think it's very important to understand what does it mean to be a general surgeon. And really, to answer your question, it depends on practice setting, whether it is academic institution, community hospitals, or community hospitals affiliated with universities, or even in private practice. But overall, there are 3 components on a weekly basis: administrative time, office or clinic time, and operative time. Additionally, in academic surgery, education and research are crucial elements. So what does it mean? This means that the surgeon's schedule will include days to see patient in clinic, days to perform surgery or other procedures, and days when they do their administrative task. The latter is usually part of a day. At the same time, they will need to round on their patients in the hospitals or sign them out to their partners. For me, as a program director of WMed General Surgery Residency Program, I spend at least 30% of time to run the program, including teaching, research, administration, and 70% in clinical responsibilities, seeing patient in clinic, engaging in preoperative care, performing surgery, and participating in taking general and emergency surgery calls. General surgeons also take weekend calls as well, the frequency of which depends on the number of surgeons in the group.
In terms of the practice of general surgery, what are the differences between academic versus private versus public versus urban versus rural?
The advantage of academic, you will have some time or protected time to do your research and focus on surgical education. especially when you work with residents and students. And community hospitals, most of time is going to be seeing patient, performing procedures, in addition to the admin. The education component, it is not well defined in these situations unless that institution or that hospital is a participating site for a residency program. When you're in private practice, most of the time your focus will be on clinical aspect of disease, performing surgery, seeing the patient, and you will have to go for your CMA credits. You have to attend some conferences, may not be in your city, but could be in another state. And you may have less exposure to students and residents. So the main academic, it is you working with them. You have the opportunity to education, to work with people in research, and that make a huge difference because the surgeons by nature are scientists. So that element of education and research is very important to have.
Do you find that if you are in an urban community that you need to subspecialize versus if you're in a rural community, you can be more of a general surgeon?
I believe general surgeons can do what people need in any community. Unfortunately, more specialization in surgical practice led to shortage of general surgeons. A general surgeon, as we mentioned in the definition of what categories they can do, they do everything. The only thing I can tell you is coronary bypass, they're not going to do it. They're not going to do brain surgery, but otherwise, they should be capable of doing every procedure in human body. And that art of practice is really is going down. And this is why the American College of Surgeons, even these days, came with the fellowship in general surgery to prepare surgeons who want to be in underserved area or private practice to do extra, additional year of fellowship to practice as an attending. But general surgeons should be able to serve the people in any location he or she was placed in.
The stereotypical statement for almost any surgical specialty is that there's very little patient contact and that there's not much of a longitudinal relationship with patients. What are your thoughts of this stereotypical statement?
I think if you practice in a specific community, you still have the opportunity to see your patient from the time they refer to you in clinic. You prepare them for surgery. You perform surgery on them. You see them after that. And if they need, for example, surveillance, if they are cancer patient, then most likely they're going to come back to you as long as you stay in that location or in that community. So continuity of care, I think, is still there. Now, if you look to residents, and the student, when they go to rotations, they may not have that experience because you go for 1 month rotation, you see a few patients, maybe one time in clinic, maybe you may or may not see them during surgery, but you may see them after surgery. So that continuity of care may not be present when you are a student. It is relatively present when you are a resident, but it is present when you are attending.
If a student were standing at the surgical table next to you, what is something that a medical student could do to take control of their own learning? What is something that says to you that this medical student is buying into what we're doing and makes me want to be a mentor to this medical student?
I think this is very important. And, I witness that almost like every day or every time I see students. There are students who are motivated, who are proactive, who are resilient, who are in hunger to learn more, who go above and beyond, who really very interested in learning something. They do not waste their time. They ask for opportunity, what I can do to improve. And these are the successful students, very successful. They can come with an idea, for example, about research, and you will give them something, and within a few days they will come back to you. And these are the ones that really I'm not concerned much that they will be successful. The other students who need, who say, I'm going to be a general surgeon, but they are not really doing what they're supposed to do. When I encounter them and I tell them surgery is a demanding specialty. You're going to wake up early, you're going to work hard, but the more you invest in your time as a student right now, the less you will need to spend as you become residents and you become faculty. And most of them, they will take it. The one who are 50-50, I just tell them this is what you're going to need to do. These are expectations, obstacles, challenges, and you have to decide. And I keep myself as a PD, I keep my doors open to any student who like to come to my office to call me. And we have been very successful at WMed. I have seen many students, and a lot of them, they went to general surgery.
What resources, whether it be websites or articles, that you would recommend to students to use to learn more about the specialty of general surgery?
Any students who is interested or wants to know more about surgery, a lot of resources available online. WMed library is one of the best and most comprehensive libraries among United States institutions. A lot of thanks to Liz Lurber and her team for outstanding job. And students, they have access. It is free. Those students, when I met with them, I always encourage them to join American College of Surgeons. This is the largest surgical organization in the world, more than 80,000 surgeons there. Just be a member. It is free membership. You will get access to a lot of things that you can navigate and decide what you want. The Association of American Medical College also is an excellent website, and students can understand even the application process, the matching in surgery, and other surgical subspecialties. They will inform themselves much better by taking the time to look what is available. So you just need to initiate and just go online. You can just navigate, and even you can talk to surgeons in the department, and they will advise you.
What would you say is the biggest challenge facing general surgery, and where do you predict the specialty to be in 10 or maybe 20 years from now?
So I think this is a very important item. And I think, despite the number of physicians practicing in the United States, almost like closer to 1 million physicians, the biggest challenge in my mind is the shortage of general surgeons. Increasing evidence indicates an ongoing critical shortage of surgeons available to serve the United States population. The report in 2021 by the Association of American Medical College showed that there will be a prediction of shortage of about 16,000 to 30,000 surgeons by 2034 or 35. And, there is an ongoing discussion right now at the Congress to increase the United States surgical workforce by increasing number of Medicare-supported residency positions nationally by 2,000 every year from 2023 through 2029. So hoping that we can create 14,000 positions. In addition, to face this challenge, the state of Michigan has done outstanding job. And 3 to 4 years ago, a new program was established in the state of Michigan. It is called MIDoc, or Michigan Doctors. WMed participates in this program, This program is a state-funded program set up to finance expanded residency positions in select specialties within the state and is for residents who have a passion to spend their careers working with underserved and vulnerable population. Acceptance of MIDoc residency slot includes 2-year commitment to practice in rural or urban underserved area in Michigan post-residency. Additionally, residents may also receive up to $75,000 for repayment of qualifying education loans. WMed is the only institution in the state of Michigan that was approved to have a spot in general surgery. Currently, we have 5 residents. There are also 2 challenges that I would like to mention. One is the interest in specialization in surgery that requires fellowship training or enrolling in integrated surgical programs is likely to impact the number of general surgeons in the future. And the other thing is the adapting new technology such as robotic surgery is going to be a challenge, especially in area with limited resources when we talk about rural communities.
If you could tell us the story about how you came to decide general surgery was right for you, maybe your struggles, insights, and then eventual that aha moment that it all made sense that you want to go to general surgery.
I graduated from University of Cairo medical school. There was 6 years plus 1 year internship. First 3 years, they are the basic science years, and the second 3 years are clinical. In the first few years of medical school, I really enjoyed anatomy classes, especially surgical application of anatomy. I spent a lot of time in dissecting room, and I have the opportunity to dissect cadavers and understand the sophistication of human bodies. In my clinical years, I found general surgery to be the field that I most enjoyed, especially when integrating anatomy and pathology in understanding the surgical disease and performing surgeries. That time I even used to go after hours and to go to the operating, you call it the operating theater. You go outside, there is a glass, and you watch the OR. I think when students show persistence and interest, they will get opportunity to be in the OR and participate. So after a few times, the people, surgeons ask me to scrub with them. And I think that solidified my interest in surgery. General surgery has a wide spectrum of disease and procedures that a surgeon can do, and therefore more opportunities to help more patients that you serve. After my graduation in medical school, I decided to come to the United States to get my board certification and go back because I believe that general surgery is my best field that I would like to practice as a career.
Did you have any, struggles or any thoughts about other surgical specialties like orthopedic surgery, neurosurgery? What made you decide general surgery over other surgical specialties?
When I came to the United States, there were two big challenges. Number one is as you know, foreign grads face many challenges when moving to the United States, from learning a new language, understanding the healthcare system, integrating themselves into a new society and culture. However, fortunately, with grit and resilience, this was not really a big issue in my situation. The second was the competitiveness of surgical residency. I remember I applied in 2001. When I came to the United States, I came in 2000. I have to take my step 1, step 3 clinical skills assessment. So once everything is done, then I applied for residency. It was very competitive, not only at that time for foreign medical grads, but also for U.S. medical students. Despite increasing number of residency programs in general surgery, currently there are between 345, 350 programs in general surgery. There is still need for more programs. Now, when I applied as residents, really I applied to general surgery as the only specialty, accepting the fact it is a risk for foreign medical grads not to match into a categorical position. But on the other hand, acceptance into preliminary position in general surgery is an opportunity for a student or foreign grads to prove self as a capable residents, to build their skills, understand the system, and allow them to have recommendation letters from those who work with them directly. When considering fellowship, my interest in certain specialties evolved as I moved in my residency. And by fourth year, I chose minimally invasive surgery and foregut surgery.
If you're a third-year medical student undecided on specialty with limited time remaining before residency applications were to be submitted, what do you think would be the fastest, highest yield route to making a decision about the specialty?
That is really a very tricky situation for these students because of the time sensitivity. Personally, I always advise students as they start clinical rotations in their third year to do their best and learn as much as they could from every rotation in medical surgical specialties. And as they progress toward fourth year, they should assess their interest and evaluate their rotations. Having a mentor early, talking to older students, engaging in research will help them to take the right decision. The time is very limited, but I think it's very important to start, as you start third year, you start building what you plan to do, and if you can do research, I think that will add more to your options. But having a mentor, talking to other people is very important.
How important or is away rotation electives in surgery or subspecialty electives in surgery important or necessary?
I don't think they are necessary. But doing a away rotation has many advantages, including exposure to a different and new learning environment, working with other people. This also gives the student the opportunity to show their skills and strengths, and more importantly, their personal characteristics as rising surgical residents and future surgeons. However, it also could have potential disadvantage if the student did not take it seriously and if they left unfavorable impression. It requires, it has a cost to it. And if student did well in that rotation, then it will, that will increase their chance to get at least interview there. So for someone who is really interested in a geographic area or a specific institution, I think this is very important to consider. As we move toward era signaling, showing interest in the area and program is becoming important elements of what we call holistic review process.
How important is research or scholarly productivity for matching into general surgery? And especially, from your perspective, as a program director, I'd be very interested to get your take on that.
This is very important, and I can tell you we have done research about this. We evaluated the importance of research over the last 6 or 7 years for people who applied to us, and we found there is not much really difference. However, I will tell you right now that with USMLE Step 1 transition to pass-fail, the holistic review is now becoming a necessity. This means every ERAS application is evaluated very carefully, thoughtfully in all elements of both the students' academic performance and personal characteristics. Research is an element. While prior program director surveys showed research is an important element, it was not of a big deal in the past for students applying to community programs. However, for students interested in academic surgery or post-residency fellowship, research is becoming an important element of these applications. And I can tell you there are certain specialties that when you apply for fellowship, if you didn't have between 7 to 10 publications, your chance to get that position is dim. So it is really becoming an important. I would encourage students to think about it and do even case reports. And the best way in my mind to do research, if you get 3 or 4 students, work together in 4 projects, that will be more productive than just one student doing one project. And they can, one of them can lead. So in one publication, student A can be the first author, and the second will be the second. And that's so more students will lead to more productivity. And I think this will help.
If you could go back and do it again, what would you do differently, and what would you do the same, and why?
If I go back, if time takes me back, I believe I will still do general surgery. One thing that I wish I could have done is to take some classes about epidemiology, biostatistics, and research, because that could help me to build my foundation to do research early in my career. Understanding also, taking some classes about business of medicine. I think in the United States, in college, there are some business classes that they can teach us, undergrads. As we move forward, unfortunately, the medicine in the United States is becoming an enterprise with advanced technology, and having some knowledge or basics about the business of medicine is very important, very critical. After I joined WMed, I realized that I need something to add. I need to know more about the system. So I spent 2 years doing a master's degree in medical management, as you mentioned at your introduction. In addition to that, with more students and more residents coming to us, I found it, to have some knowledge about biostatistics that can help them. So I went online, I learned a lot, and I registered and enrolled at Harvard. Over 1 year, I got my certificate in advanced biostatistics. That helped me as residents and students come to me. So instead of waiting maybe 2 months or 3 months for someone to help me, no, we can do it.
What is a career mistake that you've seen other physicians make? And what is something that you've seen another physician do well that has made you want to emulate it?
I had been working in my role as associate PD, then PD, over the last 10 years. And I have worked with residents who trapped in a problem of their choice or miscalculation. I think a big mistake a student can make is choosing the wrong specialty, thinking that things will be better as they start residency. Surgery is about skills and knowledge, and we cannot really differentiate. You have to have skills and you have to have knowledge. And if a student doesn't have basic skills and is not willing to invest in their learning, then they will struggle. They will burn out. They will eventually leave surgery to another specialties. And it's very important that students should be honest with themselves first about their abilities, interest, and dedication. I like also to remind students that surgery is a demanding specialty. Residents go through intense training for more than 20,000 hours or 5 years. And I think they have to consider that. I have residents who start with us first year, they did okay. Second year, we start seeing struggles with skills, but they still want to be surgeon. Then third year, then the agreement that they cannot be surgeons. And I have to sit down with them and said, you know what? Over the last 2 years and a half, I have witnessed that you are really good when it comes to reading CT scans and X-rays. You take your time, and to me, I believe this will be the best specialty for you. And I said, my goal is to support you, to help you, but I believe you're going to be successful in this. Let me help you. Finally, for that residence, he's now very successful interventional radiologist. Other people who think that I'm going to be a surgeon, then they cannot be, but they can be in different specialties. The student themselves has to understand persistence in pursuing something that you're not fit for. It is not going to come back to you with good things. You have to be flexible and honest with yourself. But again, I think student has to decide what they really want to do and what they like. Because one question, if you want to be a surgeon, are you going to be happy to be called at 2 a.m. to go to see a patient in the hospital while everyone is sleeping, is enjoying their night? If the answer is yes, then you go for it. If the answer is no, then you're going to focus for something else. The other side, how many times we have seen people who were in other specialties and came to surgery. It is not very common, but I have seen people who did maybe 1 year or 2 years, whether it's family medicine or internal medicine or emergency medicine, then they move to general surgery. But that's not very common.
You touch upon something that, in terms of waking up at 2 a.m. To go to the hospital, do surgery. Do you find, or when advising students that are considering the specialty, as well as residents, I mean, and probably maybe yourself, having a family life, how difficult is it, being a surgeon and having a family life? Do you find it challenging? What are your thoughts on that?
It's very important to consider, what will happen to you in any specialty you go if you are thinking about families. And there are people, or there are residents that they will be fine to work hard to take calls and be away from family. I tell students that you have to keep in mind that your specialty that you chose is going to be forever. It's not something that you said, okay, I'm going to change it. So if you're thinking about lifestyle, that you want to be with your family every single day, every single night, you want to be home, you don't want to take call, then maybe surgery is something that you have to reconsider, maybe not. And you have to be fair and look what's going to make yourself and your family very happy. I have also few students, not a lot, few students who were considering surgery. Then they changed their mind when they apply, and I have to, to write them letter of recommendations. And I said, why you change your mind? And the answer was, I'm looking to build family, and I feel that's going to be distracted to me. And I don't want to, to put my family and career at risk. I think if I do this, the specialty that will give me more freedom and more flexibility to do what I like to do and to be also with family.
What is one thing that you're struggling with or lamenting about your career today? And what are you doing to remedy it? And what would you encourage a medical student to do right now to help avoid this problem entirely later?
The striking thing we see is the technology. Technology is evolving. Artificial intelligence is here. Machine learning here. All are advancing surgery. It's really very hard to keep up with all these changes, but it's going to be the future. And it must be part of surgical training curriculum. And students, they have to be prepared, and I think they're smart and able to handle multitasking. But this is going to be the future. And I think myself, I struggled with it because I came from open surgery, laparoscopic surgery, then I start practice. Now we have robotic surgery. Should I adapt it or just do what I'm doing? Well, the industry is pushing things forward. And if you're not up to date, you will be like outdated. So that's really very, very challenging. And I didn't think the current generation of students will have problem, but they have to keep it in mind that I have to speed up. Everything is so fast. At the end, also, one thing, student, they have to have the motivation to go above and beyond and love what they do. And, that make them very successful.
What is one book, medical or non-medical, that you think every person pursuing a career in medicine should read?
There are many books that have been written about medicine, and even books written by surgeons and physicians. But I think for me, if someone interested to know more about surgery, or he wants to, especially student, they want to discover or explore the surgical field, I think a history book about surgical evolution is might be interesting for them. There are books that are published by the American College of Surgeons, but there is also one book that I came across. It is called a History of Surgery. It is written by a surgeon from United Kingdom. Name is Dr. Harold Ellis, and that can take you from thousands from the Egyptian ancients about practicing of surgery and medicine, then through evolution until now, where the minimal invasive surgery, robotic surgery, and reading through the book, they may find it very interesting.
Is there anything else that I didn't ask that you want to make sure that our listeners know?
I think the most important thing when you're in medical school is to invest every moment in your time for education, learning, building towards your career. Because at the end of the day, you are going to be, as a student, you are going to be the one who will enjoy or suffer with his or her decisions. Take an opportunity to learn from medical school. When you're in the hospital, take the time to learn. You already, I think the cost of medicine in the United States, going through medical school, is very expensive. And just remind yourself, you are paying to learn. So learn from every rotation you get chance to be in, and analyze, reassess. Do I like to be in pediatrics, for example, or do I like to be in neurology, orthopedics, radiology? Just back and forth, double check yourself, because any decision you take, it should be based on what you think is going to help you down the road. And I believe, WMed is doing an excellent job, and you can see the match. The match rate for WMed is never dropped less than 98%. I think over the last 3 or 4 years, it has been 100 to 99. So it's not going to be difficult to match, but you want to make sure that you match in what you want, for the rest of your life. And I wish them the best. And from surgical standpoint, the program director, I get motivated when I see students who really interested to be surgeons, and I have purchased a bunch of books to give them as gifts so that way open their eyes and work to achieve their goals. But I wish them the best, and if they have questions, they can come to us, and we'll be happy to help them.
If a student has questions, can they reach out to you?
Absolutely. They can reach out to me by email or can come to my office. I keep my doors open for them and support them in any way that I can.
Thank you, Dr. Shebrain. I really appreciate it. This has been wonderful and great advice that you've given. Well, I hope you enjoyed the conversation with Dr. Saad Shebrain. For the resources and other tidbits that were mentioned in this episode, you can find them in the show notes on the WMed website, wmed.edu/specialty spotlight. If you liked what you heard, please share this episode with your fellow medical students, especially if they're having career anxiety. It is truly my hope that these conversations with physicians who have been there and done that will help you move forward with your own career choices. For any questions, or if you'd like to reach out to me for any reason, which I encourage you to do, you can do so by emailing me at biren.shah@wmed.edu. But until next time, take care.